Senator Matt Klein will be representing the northern portion of Eagan again. He won a second term this fall by a comfortable margin. Senator Klein is here now to talk about what's next. Senator Klein, welcome to the program. First of all, congratulations on your re-election.
Thank you so much, Mike. What a privilege to be on the program, and thank you to the voters of our area for putting me back in St. Paul this year.
Yeah. Now, you're one of the few medical doctors in the Minnesota Senate, so you've got a professional and a political perspective on the COVID-19 pandemic. What do you see as the biggest challenges, and how can you, as a minority member of the Senate, try to solve them?
Yeah, and this is, well, hopefully this is both a challenge and an opportunity for us to set aside partisanship. Once again, the voters of Minnesota have decided to make us the only split-party legislature in America. At a time when there's going to be a singular historic need to help our communities to get through this with our health, our personal health, and with our economic security. So the parties are going to have to set down partisan arms in a way never before and get through this thing. You're right. I'm one of only 4 doctors in the legislature currently, which at the start of the new year is going to go down to 2 doctors, just me and Kelly Morrison. I do think we bring a unique perspective. I continue to serve at the hospital. I go in 3 nights a week to Hennepin Healthcare and take care of people with COVID. So I go actively into the rooms of people of all ages, all income levels, and all backgrounds, all races, who are varying levels of sick with COVID-19. So I see it very personally, from the person who just has a mild sore throat and a fever, to the person who's literally starving for breath and is making hard decisions with their family over the phone. And I think that informs, what I can bring to the Capitol. We are going to, sorry to interrupt, go ahead.
No, I'm sorry, just to keep going. I was going to say there's really kind of 2 components of this. There's the response and how we're dealing with it in terms of taking care of the sick, and then there's also the businesses and the, just how we're all trying to do economically on this. And I know that those 2 get linked a lot when we talk about this, because some people see as you're giving you as a trade-off, so, but tell me what we can do.
Yeah, they both fall into the category of shared sacrifice, which is not something that we've had to do a whole lot of in the last, 50 years of economic prosperity in America. But we all need to, with Governor Walz's new impositions, closing gyms and restaurants and so forth for 4 weeks, obviously that places a burden on all of us, especially the people who own those businesses. And a mantra of mine is that if the government asks you to close down a business, then the government has to find a way for you to pay for it and get through that, so that you're still on your legs when the shutdown ends. And we need to, we're going to meet in special session in December, hopefully pass some economic support for these businesses, but we definitely need the federal government to sort of step in with their enormous, tremendous resources and get us through this. It's only fair. If we're going to ask businesses to close down, we've got to help them get through it.
Now, I know on the other side of the aisle, they will be eyeing the deficit that's starting to be run up here, or it's not a deficit because we don't deficit spend in Minnesota, but the potential shortfalls in the budget. There are only 2 ways of really solving something like that, raising revenue or somehow cutting expenses. I mean, where do we look?
Well, there's a third way. Through the wisdom of legislators before me, like Richard Cohen and others, we have a rainy day fund. I think it sits at about $2.4 billion right now. Obviously, you don't want to spend that all down, but if it's not raining now, I'm not sure when it's ever raining. So we need to use that as a resource to get through this. We will have to trim our belts. Everyone in Minnesota has had to tighten their belts in this, and the state government will be no exception. There will be areas of cuts. I know they will be painful for whichever agency is affected, but we need to be prudent and we need to find ways to do it. And yes, I do think there are ways that our wealthiest citizens can contribute more and get us through this time, even with temporary tax raises, to sort of sustain businesses and sustain individuals through this difficult time.
So when you start talking about that, the tax word, obviously that means that you have to get it through. You have to get some support from the other party. How do you do something like that right now?
Well, good question. If you have the answer, please let me know. I think you just have to form relationships. Everyone has to understand the concept of shared sacrifice. I think it means that a Democrat like me has to be willing to give on things like cuts, which is not typically an area where Democrats stride out. But if you can come to some agreement, a combination of spending cuts and tax increases, it seems to me as though you could build a bipartisan coalition around that.
Let's talk about something that's underlying this whole COVID-19 crisis, which is the fact that we've kind of really exposed that we have a healthcare crisis. A lot of people are having trouble getting healthcare. It affects people disproportionately who are poor or are minority.
Yeah.
You have called for a public option. What might be able to be done about that in the coming session?
Yeah, well, thank you so much for giving me the opportunity to speak about that. And you're right. If COVID-19, in healthcare, as in so many other areas, it has revealed sort of these underlying unsafe inequities in our society. And healthcare is certainly one of them. We know that people still avoid healthcare because they can't afford their deductibles or their copays. We know that people still forego getting medications because they can't afford those. And in the past, it's been understood that that affected their personal health. I think with COVID now, we understand that it affects all of our health. If somebody who has a sore throat and a cough and a fever and is sitting at home or going to the store and they choose not to access health care because they're worried about how much it costs them, everybody else is affected by that, right? Good health for one is good health for all in our society. I have continued to support and be the chief author of Governor Walz's One Care, which is a public option, affordable public insurance product that everyone can purchase into. We already have it in the form of Minnesota Care for low-income working people. I still believe that every Minnesotan should be able to purchase that insurance product from the state. We know it's affordable. We know it provides good health coverage. And it competes with sort of the private insurance industry, which gives us some economic leverage with those insurance companies. So I still think it's a good idea. Candidly, Mike, it's not an idea that gets a lot of love across the aisle. And I think every legislator has to have an agenda that they're going to push if they're in the majority, and a different agenda if they are not in the majority. And this may be one that's a little more difficult in this particular term when I am not in the majority party.
So what do you see that actually can get done this coming session where we have divided government? What, especially those items that you have on that you support, what do you think can happen?
Absolutely. Well, just to recap real quickly, we of course need to do continued measures as a legislature about public health and get us through this with our physical health intact. We need to address the economic crisis faced by Minnesotans. Those will be the 90% of the work we need to do this session. But in terms of affordable health care, which remains my mission, we've had some bipartisan support for regulating the pharmaceutical industry and drug prices. People saw the crisis with insulin and felt deeply and personally how that was immoral, that people couldn't afford their insulin, which is a cheap drug to manufacture. And we've had some luck in sort of establishing an emergency insulin fund so that if people can't buy their insulin, they can get it at a low cost. We passed a bill last session in a bipartisan way that would at least ask pharmaceutical companies to be transparent about their pricing and justify their pricing. What I would like to do is move that forward and have some regulatory capacity at the state so that if a drug price increases by 8,000% in the span of 1 month, we as a state can investigate that and impose some fines if necessary to bring that back into check for Minnesotans.
Wow. Well, it's getting anything done, as we've seen in a divided legislature, is a difficult task, and we wish you well on trying to get some of that stuff done. We've been talking with Senator Matt Klein, who is the re-elected senator for Northern Eagan, as well as the northern part of North Dakota County here. And Senator, we really appreciate your time for talking to us about what's next for you.
I'm so grateful for the opportunity to speak to your listeners, and thank you again to everybody for sending me back to St. Paul. I'll try to do a good job.